Your CNOS Health Watch on Siouxland News.
Many people are familiar with headaches, but when is a headache something you should be concerned about? Siouxland News reporter Katie Link talked with a CNOS neurosurgeon about a rare malformation of the brain.
Most of the time, our brains fit nicely inside our skulls, but every once in a while, something goes wrong.
It actually floats in a fluid, but it's a very tight fit. And if you have a situation where the brain actually happens to be slightly larger than the skull, then pressure builds up. And that is essentially what happens in chiari malformation.
Dr. Quentin Durward is one of 5 board-certified neurosurgeons in Siouxland, all located at CNOS. Dr. Durward says they see about a dozen cases of chiari malformation here in Siouxland every year.
Because it's related to pressure on the brain, people tend to develop other symptoms, such as they might feel like they're beginning to black out or faint, or they might have a loss of their vision that occurs, like developing progressively a tunnel vision.
Dr. Durward says most patients complain of a headache first.
They're often related with straining measures, for example, coughing or straining at the toilet. That elevates the pressure inside the head and tends to make the symptoms of chiari malformation, particularly the headache, worse.
With follow-up tests, a doctor can see immediately that something's wrong.
The doctor would normally order an MRI scan, which is almost 100% certain in its diagnosis of this condition.
While it's rare, surgery is the only solution.
We actually remove the bone over a segment like that, like I'm drawing here, approximately the size of a silver dollar. And after we do that, we open the membrane that lines the inside of the skull, and we sew in an artificial patch.
The patch makes extra room so the brain doesn't put pressure on the spinal cord, causing those side effects. And while brain surgery is always major surgery, the recovery is surprisingly easy.
Typically, the operation takes about 3 hours to perform, and the person may be in hospital for about 3 days after, then able to go home. And in most cases, they're fully recovered within 3 to 4 weeks.
For Siouxland News, I'm Katie Link.